Jake MacDonald, Chapter 9, Segment 3 Outline. Humans always learn in some setting, mood, or under some circumstances. Surrounding characteristics while learning often aid in memory retrieval at a later time. Context-dependent retrieval is the improved ability to retrieve information when the conditions of the original learning are reproduced. Memory trace is the physical record of a memory made in the brain by a learning experience. The fact that the context surrounding a memory is supported by the definition of flashbulb memories. Flashbulb memories are vivid, detailed memories of a momentous event. Often, the accuracy of memories is dependent on many factors, such as the way that a question is asked. The misinformation effect is the susceptibility of our memory to incorporate false details that fit in. Language can often impart bias on visual memories. The 7 sins of memory, according to psychologist Daniel Schachter, are the following: blocking, which is when a memory seems to be blocked; absent-mindedness, which involves lapses of attention or forgetfulness; transience, which is the fading of memories; bias, which is the distorting of old memories to fit current beliefs or knowledge; leading question, which involves suggestive questioning; misattribution, which involves attributing a remembered detail to the wrong source; and persistence, or when unpleasant memories seem to linger. When memorizing a list, making sure the information is accurate and overlearning it helps commit it to long-term memory rather than short-term memory. Individuals can aid their memories by using mnemonic devices, or methods of helping to memorize information. For example, the method of Loki is a mnemonic device where each item of a list is imagined in a separate location in a familiar place. The tip of the tongue phenomenon is when we feel that we can almost say aloud the word we are trying to remember. A good way to conquer this phenomenon is to simply list possibilities out loud. Freud found that they often all begin with the correct letter. Many kinds of brain damage due to disease or accident can impair memory. Some resulting issues may include the following: amnesia, or a severe impairment of memory; retrograde amnesia, or amnesia of events occurring prior to an event, typically a trauma; anterograde amnesia, which is amnesia for events occurring after an event, such as a trauma. Patient HM is Henry Molaison, a patient who, because of bilateral medial temporal lobe damage, could not form new explicit memories. The hippocampus is required to put memories into long-term memory elsewhere in the brain. The medial temporal lobe is the innermost portion of the temporal lobe, which includes the hippocampus and the neighboring cortex. The hippocampus is part of the limbic system and is crucial in the formation of permanent memories. Its name is Latin for seahorse, and it is named for its swirled shape.